Hi friends and families, it is Reggie Reddy, the holistic dentist all the way from Sandton, South Africa. Today we'll be discussing oral natural medicaments that affects your oral health in relation to your oral systemic health profile. The first medicament we'll be discussing is tea tree oil. Tea tree oil is a age-old natural essential oil, and its effects that harvested in an area in Australia that the least amount of pollution, hence that it's got a name called tertiary plantation. So these oils have multifactorial effects. One of the critical facts that tea tree oil has, it reduces the bacterial count. The bacteria lives in carbon dioxide, and that bacteria lives around your gums and around your soft tissues, the ligament structures that hold your teeth into place. But it also affects your throat in terms of any bacterial area, what we call in the back of the throat, your tonsils and the uvula. So it's the site specific to bacteria lives in carbon dioxide that's in your gums. So the recommended dosage is that 2 drops of tea tree oil in hot water, let it cool, and gargle every night after brushing and flossing your teeth. In acute cases whereby you have active infections, we recommend you to gargle with 2 drops of tea tree oil 3 times a day. So there are studies to show that gargling with tea tree oil on a regular basis over a 21-day period reduces the bacterial pathogenic count in the mouth that causes your gums to bleed and cause eventually your ligaments to dissolve and your teeth to get loose. The second positive effects it has in the oral cavity, that around your area of your throat or any irritations in your area of your tonsils, of your uvula, any latent bacteria that lies in the area is reduced substantially by regular tea tree mouthwash gargle. And we find the essential oil to be the most effective instead of the diluted one that you buy off the counter. It's 2 drops of tea tree oil in a glass of hot water, let it cool, and into a warm state you'll gargle all around and swirl it around your mouth and into the back of your throat, and then you would spit it out. So if you, in cases whereby there is acute infections, you'll gargle it. The gargle is used every 8 hourly. Once you are in a stable state, I recommend every night before going to bed, gargle with tea tree oil as described. The second medicament we're discussing today is about what we know as curcumin, or some people know as turmeric. So ideally is that you need the raw turmeric from the plant which you grow, but obviously that in South African circumstances and globally in many countries, unlike in Asia and some parts of Africa, we're able to grow it actively, but it comes now in capsules called biocurcumin. The effect of biocurcumin on the oral tissues, it decreases firstly the inflammation. Secondly, it has effect on decreasing the bacterial pathogenic count in the mouth. So it is prescribed that you should have in active infections 1 capsule 3 times a day and over a 21-day period, and you reduce it to 1 tablet twice a day. After the next 21 days and the following 21 days, it's 1 capsule daily. Besides the oral cavity, if positive effects it has, it also has effect on inflammatory areas in your whole body system. It's often combined with some other medicaments like ginger, and to reduce inflammation in terms of sports injuries, perhaps in mild cases of arthritis and inflammatory soft tissue. So this takes us into the next medicament, which is in a natural state called ginger. Ginger, as you know, is a root that's in a tuberous form that's underground grown, but it's often used in many culinary arts throughout the whole world as an adjuvant, as a spice. But the interesting thing is that they found that ginger now also acts as an anti-inflammatory and reduces pain. Hence that now they've produced ginger in the form of a capsular form. So Ginger is often used as a substitute for other inflammatories like non-steroidal anti-inflammatory drugs, and is used with proficiency and efficiency provided that you are regular in your consumption. So ginger capsule is recommended to have 1 capsule twice a day. So it reduces the inflammation in the oral cavity, but also reduces the inflammation in other parts of the body, as I mentioned, in certain types of arthritis. The ginger capsule is administered whenever you have an inflammatory condition and is not used as an ongoing supplement, right? So it's used in cases whereby instead of aggressive non-steroidal anti-inflammatories, you will introduce ginger capsules. Okay. The fourth medicament I would like to discuss about echinacea. Echinacea has certain properties regarding reducing the bacterial count. For example, if you have inflammation in the oral cavity, and in fact, if you have early certain streptococcal infections like certain influenzas or throat infections, you would use the tincture 5 to 10 drops on your tongue every 3 hourly, and in severe cases, and obviously you can even use it hourly until the acute phases decreases. Thereafter you can use it on a 6 hour. Again, it's not meant to use as a ongoing medicament, but used in certain conditions where we have active bacterial count in the oral cavity. And the science shows that it's complementary to many of the antibiotics that's ingested for other viral infections, and to some extent bacterial, aggressive pathogenic bacteria. The next natural medicament I'd like to discuss is coconut oil. And there's a lot of discussions on the internet and Google and other medias about coconut oil and coconut oil pooling. Let's discuss what is the effect of coconut oil or coconut oil pooling. Basically is that if you apply it on all your teeth, even without swelling out your mouth, the oily effect of the coconut oil decreases the proliferation of pathogenic bacteria. Hence, bacteria cannot proliferate and aggregate substantially. If you swirl it around your mouth, starting with 1 minute, and increase it to as long as you can, and some people say 21 minutes or 30 minutes eventually, in all your mouth, it found that it reduces the bacterial count substantially in all your oral cavities. But the effect of that, it also reduces pathogenic bacteria in relation to your GIT, starting with the esophagus down to going to colon and your large intestine and small intestine. So there's a lot of positive effects in that. What is the science behind it? So the coconut oil that's used, it affects the pH from an acidic state to an alkaline state. We know that from medicine, if you're in an acidic state, you are unhealthy. If you're in an alkaline state, you are healthy. And coconut oil addresses that issue quite substantially, whereby produces an alkaline state, and bacteria can aggregate and become pathogenic. So it becomes inert. So basically in children, what we do, because they often cannot swallow in the mouth, so we ask the mothers to take the coconut oil either with a finger or with a cotton earbud, apply it on all the teeth, especially in the grooves of the teeth, so where the bacteria tend to sit and causes demineralization. In terms of in the mouth, you can start with half a teaspoon or a teaspoon and you swirl it on all your mouth, and you keep it as long as possible. I recommend you start with 30 seconds and you start with 1 minute until you come to comfortable with 21 minutes, and then you spit it out. You can have it in your mouth and do all your chores of the day, and you can do basically a normal work having it in the mouth. It doesn't affect your time. I think the consistency and being constant in the program is critical to reduce the bacterial count, right? And we have, from a holistic perspective, it doesn't have any side effects, and the most important thing, it has a positive effect in your whole oral systemic health. Let's discuss something about alkaline powders, right? There are many kinds of alkaline powders. There is multiphos by Vogel, there's alkaline powders by Healthways and a few other companies. And let's understand, why do you use this? Most of these alkaline powders have got a bit of charcoal inside, got a bit of Epsom salt, got a bit of bicarbonate, and there's a ratio. Each company differs on it, and but that's the basic substitute offered. So the alkalizing powder in adults we recommend 1 teaspoon twice a day, and in children half a teaspoon twice a day, and in infants 1/3 of a teaspoon twice a day. Let's understand the effects of it. Alkalizing powder again is a critical factor in addressing the pH imbalance. Today, because of modern day diet and junk foods and contaminated foods that we buy, and without even knowing it, the foods have been irradiated. So all these affect your pH. But the most understanding medical science is discussing pH. So you find that, as I said in my earlier statement, that if you're alkaline, you're healthy. If you're acidic, you're not. So the alkalizing powders is critical in alkalizing the body to ensure that we remain in a pH balanced state. Thank you very much for listening and engaging on a global level, and how we can help as integrated practitioners to affect your oral systemic health. Have a great day, and we look forward to you in the next set of videos with my dear colleague, Daniel Pillay. Thank you.